right, welcome to the podcast.
Hi.
How y'all doing?
Good. How you doing?
So let's begin by you all sharing a little bit about yourselves and what you do.
Okay. I am Tynisha. Everybody calls me Ty. I am a veteran. Oh wow. I'm sorry. You know what though? That may have been a true blessing because that was actually our fertility office calling us. I know how I know right now. But I'm a wife.
I was like, y'all need to step away and take that call.
Corey's gonna take the call. Hopefully,
it's like good news. Look, I was like, we all need good news here.
I'm sorry. I'm a wife. I'm an angel mom. I'm originally from Houston, Texas. I call now Washington, D.C. metro area my home now because I got stationed here roughly about 12 years ago, in which I met my now wife and decided to call Washington, D.C. home. And I transitioned out of the military into what we call civilian life. And I have been a civilian for about 10 years now, and I work for the DoD as a healthcare analyst. So
nice. So we'll continue on the journey, and then we'll have your wife hop in when she comes back.
Okay.
So take us back on your journey to motherhood and share with us your love story and your fertility journey, because it's been a journey, sis, and you both have a story to tell. So
it has been a journey. I remember like young adulthood thinking like kids like like I'm out here in these streets, like I'm living, like it just wasn't on my radar of like top things that I wanted to think about. I was like, I'm in the military, I need to be physically fit, I need to be ready to deploy, and which I did do that twice in 2005 and again in 2007. So I was very career driven. Like I wasn't thinking about like, oh, I need to be preparing or getting tests or doing those things. I just wanted to be a young girl, like living and not trying to check all these boxes that the world tells us that we have to check. Good news.
Yep. Tomorrow. Sorry. We just have to go back for another appointment in the morning.
Okay.
K Street.
Okay. Same, no issues.
No.
Same medication regimen.
Yep.
Okay. Thank you. Thanks. Sorry, babe. Do you want Tori to introduce herself before we keep going?
Yes, come in the camera and introduce yourself. Come on. We want to see you.
I'm Tori. Well, see, I'm camera shy, very much so. But I'm Tori. I am 34, just had a birthday in February. What else? I play lots of sports, football mainly at this point. What else? I work for the transit company. Been there for 15 years. So hoping to retire very soon.
Aren't we all?
I know. I guess that's about it. All I can think of.
Cool. Well, you hop in as Ty continues the story on y'all's journey to parenthood.
Absolutely.
Okay.
Very shy. It was like convincing her. I was like, babe, come on. Like, it's like, she's like, you sure? I'm like, yes, I want you there. I want your support. You should be here. So
I'm here.
Yeah.
I'm here.
Super great partner, but just very much so a introvert for sure. With her extrovert wife.
Yeah.
And so what I was saying is when I was young, I just wasn't thinking about pregnancy or anything like that. And then I met Tori and I felt like madly in love. Like I was like, I have never felt this love. Like I felt love, but this is different. This is like marriage different. And so it got me to thinking about all those things. Like kids and a home and marriage, all the things that I never thought about. Even shocked some of my friends because they were like,
Yeah.
what? I'm like, I know. And so me and Tori had started dating in 2012 and like 2018. So 6 years into the relationship, we were like, we want to try. And we were like, yeah, you know what? Let's start getting some testing done. Let's go. I was creeping up that hill to 30. So it was like, you know what, let's just try. And everything was fine. All of our testing was fine. They did say that I did have some hirsutism, some PCOS type of things happening, some polycystic ovaries and things like that, but nothing that they were kind of like alarmed in terms of we're going to have difficulties getting you pregnant. You know, all results were like, come on, mama, let's go. At that point, we started IUIs and we were paying out of pocket for all medications, all the cycles.
Yeah. Yep.
It was a rough.
I was just wondering if y'all could see my face. Like I'm thinking dollar signs, dollar signs,
Now-
dollar signs. And if you're comfortable with sharing how much, I would love for you to do so, because I don't know if people understand the burden, the financial burden of going through even IUIs and then eventually going through IVF.
Oh, yes, ma'am. So it was about 1,800 per cycle.
Yeah.
And let's be clear, we did 9. We did 9 IUIs. And when we got to number 6, the doctor was kind of like, so we want to look at some weight loss. We want to look at putting you on some metformin, changing up your protocols. And then, I mean, and at that point, I had literally started at like the baseline of like all the protocols. And then slowly after every cycle, they was like, okay, now we're going to add this, now we're going to add this, now we're going to add this. So the cost just kept going up and up and up per cycle, because now I'm on more meds and I'm trying to manage what all these meds are doing to my body. I'm hormonal. I was getting night sweats. I mean, it was just so much happening at one time. And then not to mention, I had this fear of revealing to the world what was happening because I didn't want to feel like a failure. There were people around me that were pregnant, having babies. So here I come. Oh, we're having problems. I just wasn't in a good, healthy space for myself to be able to reveal that. I was in fear. I was embarrassed. So that in itself was putting a strain on the relationship. And then in December, we got news that our IUI worked. And so we were like, number 7 worked, like round 7 worked. I remember going home for Thanksgiving, and I'm from Houston, and at that time I had promised myself, I was like, you know what, you're not testing, you're not going to drive yourself crazy. You're going to go home, you're going to visit your family, and you're going to enjoy your family. And then I started thinking, I got up in the morning, I was like, cycle hadn't came. So I snuck out the house, everybody was asleep. I ran to CVS, I got a bunch of tests. I was in the bathroom, Tori was asleep. I was in my mom's house, I'm like peeing, I'm like, oh God. So now I wake her up, I'm like, and she's like, shh. And in my head, I was thinking, this is so beautiful because I'm at home with my mom, you know, like this is why God wanted this time, because I needed this nurturing from all of my family. And so when I surprised my mom and I gave them their Christmas gifts while I was down there for Thanksgiving, because I wouldn't see them. So I kind of dropped the pregnancy test into the gifts, and they were like everybody was ecstatic. It was beautiful. I got to share it with my childhood best friends from Texas. It was beautiful. Came back home, 9 weeks had at 8 weeks had a ultrasound. They were like, we don't see the baby's heartbeat. And then they were like, but your numbers are really, really high. So wait a minute. And so they retested, came back, and they were like, your numbers are astronomical. There's a baby in here somewhere. So it's probably ectopic. We need to rush you upstairs to the 5th floor to give you an injection. And at first I was like, what? Ectopic? What? Explain it. Yeah, like what are you talking about? the baby's like, what? I hadn't even processed something could go wrong. I think both of us, we were like,
in shock. Like, what you mean?
what do you mean? Explain that. And
Yeah.
so when she explained everything, it was like, okay, I'm going to give you this injection in your rear, and then we're going to send you home for a few days. I was like, no, we're not terminating the pregnancy. It took about 30 minutes of them saying, Mom, you could die.
You can
Like,
bleed
you
out.
have to do this. And then Tori's like crying, like, honey, we could have more babies. I can't have another you. Like, you got to take this shot. So finally I took the shot, and I was devastated, because then there was this trauma of, one, in the instant that joy is sucked out of you. And then there's a second decision that I consciously took a shot to terminate the pregnancy. And although it was to save my life, that's not the emotion that I was processing at that time. It was that I was doing this to my child. And so that in itself was just like, woo, it was a lot. We took some time off, and what we did not do is we didn't do any counseling. We didn't do any therapy. We were kind of just like, what, like in a ball of mess. At that juncture, it was my first loss. So I didn't know what to do, how to share it, who to share it with. So I would tell anybody who kind of sort of asks, like, what's wrong? Like, oh, like, and then the responses that I were getting, some of them were so insensitive. They were so unloving, unnurturing, and from women. And I don't believe that it was intent, but negative intent behind it. I just think that women tend to think, oh, girl, we all done been there. You're gonna be fine. And it's like, but I'm not fine. Like, I'm hurt. Something ain't right inside of me right now. You know, I was told, girl, people have miscarriages all the time. Like, it happens, it's normal. Like, you'll get over it. Like, what? What was talking about? Like, what? Like, and it's that created an additional layer of trauma. Because at that point I was like, well, I'm not telling anybody. I'm not telling anybody. I'm scared, because I'm not even getting. And then my mom is the most beautiful spirit ever. Like, she would lay down in the middle of the road for her children, and even she could not understand and kind of wrap her arms around what was happening, because my mom got pregnant twice and she had 2 kids. So she could not wrap her head around what I was experiencing. All she could say is, you're gonna be fine. Like, try again. And it's like, I ain't there yet. Like, what we talking about? And then in July of the next year, Tori proposed to me. So it took away a lot of the focusing on having a baby. We were like, in that point, I went into, I'm very type A. So I went into full on wedding mode. Like, I was like, wedding, like legit. Like, I was like, books, checklist. Like, I was all over it. So for like a year, I was like, no, wedding. I wasn't even focused on it. And then on top of that, we had our friends who were also getting married a year before we were, and I was a maid of honor. And so then the whole wedding thing had my mind just blown. And I wasn't thinking about nothing about no babies. And then our friends got married in March of in St. Martin.
St. Martin.
And we were like, we're gonna try when we leave here, because this is beautiful. It's a beautiful season. Like, and then me, my type A self, I had the calendar out. I was like, okay, so if I get pregnant in March, my wedding is in. So, we're gonna have a little 1.5-year-old walking down the aisle, flower boy, like, in my brain, I'm like planning all of this stuff. I'm like, yep, it's gonna be bomb. I'm looking at flower, like, the baby ain't even here, and I'm shit. And my poor wife over here just like, we gonna do this. Like, she is so supportive. It's so beautiful, like, so beautiful. I'm so serious. And that's exactly what happened. We came home. First IUI, pregnant. Number 8, pregnant. We were like,
did you do the same protocols that you
Same
had
protocol.
as from the previous one that you got pregnant before the ectopic? Okay.
Same protocol. The Yeah, same
Mhm.
exact protocol.
Same.
Nothing changed. And then we were like, oh, no, ready. They told me to lose some weight. I lost some weight because my wedding coming, so I'm trying to be fine in my dress. Like, okay, maybe that was what was needed. I was more in a relaxed state because again, this joy of like wedding bliss and all this was wrapped in my head. And went in for, and we got pregnant around Mother's Day. So very late April is when we did the procedure, and then we found out very early May, like you're 2 weeks wait, like, yep, mommies, y'all are pregnant. So then the 2 weeks later is when we went in for the first ultrasound, which was the day before Mother's Day.
Yep.
And the baby didn't have a heartbeat. And I was like, God.
And it was COVID, so I couldn't even go in with her.
Yep.
So I was outside waiting. Well, actually, it was on FaceTime.
Yeah.
Oh,
No.
no.
The doctor asked me to call you once she couldn't find the baby's heartbeat. She was like, please, somebody call Tori right now. Like call Tori.
Yeah.
I physically collapsed, because it broke my heart because it was the day before Mother's Day. So I just knew again, I was like, oh, look, God is showing out. Like, I was in joy, and that baby did not have a heartbeat. And they were like, go home, mommy. Your body will recognize that you're no longer pregnant, and your body will begin to pass the tissue.
Yeah.
And I was like, okay. A week went by. 2 weeks go by. Going into the third week, nothing. And I'm getting sicker as the weeks go on because I'm assuming my levels are still rising, not understanding that I'm no longer pregnant. And I'm now having morning sickness. My boobs are tender. So I said, no. So we called the doctor and I said, I'm no longer walking around with a dead baby inside of me. Y'all are going to have to figure this out. I can't. I'm actually now every day I'm anticipating the bleeding. I'm anticipating the pain. And now I'm Googling things and reading, trying to figure out how much pain I'm gonna be in. Like it was just so traumatic. And so they were like, okay, come on in and we're going to do a DNC. And so that's what happened. They did the DNC. They sent the baby off for testing because they were assuming like something had to be wrong. Like women miscarry for a reason. Healthy baby girl found not a single issue. Nothing. Like they couldn't explain it. Literally, when we went back into the doctor's office 2 weeks after the DNC, that doctor said, and my mom gets so upset every time I repeat this. She literally said, like, unfortunately, you just had bad luck.
Yeah.
She literally was like, there's nothing wrong with you. She was like, you're perfectly fine. Like everything works. She was like, you just have bad luck. And we were like, well, we got bad luck. Like, what do you do with that? Because see, if there's something medically wrong, if you told me that I needed to do this, like you told me last time, Mom, I think you need to lose some weight. I think you need to, I can take that because that's something that I can kind of control for myself. I can get out there, I can eat less, I can work on my diet, I can get out here and start walking, I can do those things. But when you tell me I have bad luck, how do I shake that? How do I adjust my life around bad luck? You know? So that was damaging. And I was flabbergasted. They let us try one more IUI. It didn't work. It didn't work, which I wasn't surprised. I was so in high stress. I had so much anxiety and tension built up in me that I wasn't surprised it did not work. And so we were like, okay, break. Let's just get married. And then I had the bright idea. Well, the doctor had already told us after the ninth IUI that she wasn't doing any more IUIs. She was like, we're done. We're done with the IUIs. It's time to do IVF. Like, you're healthy, you're young, your eggs look good. The babies were healthy. Even our son, when they did the emergency surgery to take him out of me on the first pregnancy, that was at 9 weeks. And he actually attached to my ovary, which happens, and they were like, this happens in 1% of pregnancies. This never happens. Like most ectopics are in tubes. They don't attach to the ovary, but he was on my ovary, and he was a fairly big baby too. Like at 9 weeks.
They have to take your ovary too?
I was just about to say that.
Oh, girl,
When
I'm like, oh, Jesus.
I
Right.
got to the hospital, they were like prepping me. They were like, okay, blood transfusion.
possibilities.
Because I was already having internal bleeding, like bad. Like I couldn't even like sit up to
Breathing.
breathe
It
at
was
that point.
pain.
I was in so much pain. Because when I totally, Erica, I skipped. When they gave me the shot and sent me home, it didn't work. It didn't work.
Oh, so you did have to go back in.
Yeah, he thrived right through that. He thrived right through that. He was like, shot. Oh, you know who my mama is? Like, y'all better get out of here with this shot. Like, no, when they brought me back in a week later, he had gotten bigger. They were like, they literally, when they gave the ultrasound, you could hear them on the phone scrambling. They were like, emergency surgery right now. Like, they
Yeah.
were like calling people. And at that point, I was telling them that I was having problems breathing. I was like, I really have problems breathing. I can't really sit up. And that's when they really were like, yep, he's tearing her insides up. Like, we gotta get him out.
Yeah.
They rushed me to the hospital. And then when I got to the hospital, because they let us drive to the hospital. When I got there, though, they were waiting on us. It was like 4 doctors, like, yep, that's her. Come on. And they were like, Prepper, you're gonna need a blood transfusion. You might lose your insides. You know, they were just prepping me for all these things. And I don't think I said a word. I don't think I said a word. I think the only thing I did is when they removed my engagement ring, I remember just wailing. Because at that point, I just felt like everything was just crashing down on top of my head. And then when I woke up from surgery, my wife, she is so divine. She literally was like, guess what? And I was like, what? They was able to move the baby? Because he go in my head, what they was able, there's a new technique, they was able to move the baby? They was like, what? She was like, nope, but he didn't have to take nothing out of you. He was able to cut around and save everything, baby. So you were perfectly, like, she was so enjoyed that we had the opportunity to do this again, to be parents, to create life, that she wasn't worried about what just happened because she was so focused on the beauty of tomorrow. And that's how I know I found my person. Because I was looking at her like she was crazy. Like, are you tripping? Like, are you not realizing what happened? She was like, but that's the beauty of how her mind works. But no, he didn't have to take anything out. And so when we got pregnant again, the doctors was like, yeah, initially they were a little nervous because they thought there was gonna be some scar tissue there and stuff, but nothing.
Everything healed well. Everything
healed pristine. And so at this point they were like, okay, it got to be IVF because we don't even have an explanation. The doctors was like, literally, normally when women come in here, we can tell them like, this is causing this. They was like, we can't even.
So at this point, it was just like unexplained infertility.
Yeah,
They really
were
couldn't
like,
give you any explanation on anything that was going on. Wow.
Nothing. And so for us, that was really hard because you want to know like what's going on with your body so you can do better to help, or is there something medically that can be done that can better prepare my body in what we're going through? And there was just nothing. And so that was hard. And so we decided to just break, like they said, start talking about IVF, and then we got the book for the IVF. and then and then it went by.
So hold on. Up until this point, were you all using the same sperm for your inseminations?
We had done 3 different donors at that point.
Okay. I just wanted to make sure we talked about that because as you all know, it is very hard to find donors. Were you all specific on what you were looking for? Were you looking for Black donors? Like, how was y'all's donor process up until this point with the IUIs? Because obviously IVF is a whole nother gamut, right? Yeah. So I want you all to talk about that before we go into the IVF portion of your story.
The ability to find a Black sperm donor is
pretty hard.
Man,
it's pretty hard.
It is. When people say, "Why all these couples out here got these mixed babies and these the pickings was, y'all want one Black man to have 100 babies? Like,
Yeah.
like
Yeah.
legit, it is so hard, especially when you're trying to make sure that you're picking a good donor and not just looking at them and being like, "Ooh, cute," but
Mhm.
like looking at him and being like, "What? How smart is this person?" Like
Yeah.
legit, genetics is a thing. Like it ain't for play. Genetics is a thing. And
Yeah.
so that I'm short. I'm very short. Like very short. So I was like, he can't be like 5'7", 5'9" now.
Yeah.
Cause like then we go, if it's we end up having a boy. Like I legit was concerned about that. I was
Yeah.
like, if we have a little boy, hey, 5'2" is a man, like not it.
Yeah.
Not it. So it was a
Mhm.
lot of factors in there. We wanted education, it was
Yeah.
height. I mean, of course we wanted somebody handsome, but that was more so like on the latter end of the
Yeah.
spectrum of what we were thinking about. I think for both of us, it was kind of like finding a donor that we both would be like, ooh, if we saw him in person, it would be like, ooh, okay,
Mhm.
he handsome, okay,
Right.
sir. Like that, more so like, ooh, he has to have green eyes
Yeah.
and black hair. He must have, nah, we weren't, we well, for us, for this couple, those weren't the things that we cared about. We definitely wanted to pick banks also that had a limitation on how many live children that donor can have.
Yeah.
And so that was important to us. And then
Mhm.
the last thing that was like super important, well, two more things. We didn't pick any donor that had any conditions,
Mhm.
any conditions, even though the doctors would say, well, long as mommy doesn't have it, we're fine. Mm-mm, mm-mm.
Mhm.
So we did, our list was very limited by the time we said this, and no conditions. And oh, by the way, we want a known donor. We don't want anonymous.
Yeah.
And the reason for that, and every couple is completely different in what they choose and how they wish. But for her and I,
Yeah.
we decided to marry each other as two women, correct? Our child does not have to live their life unknowingly of who their father is, because our choice to live as two women. I cannot live with myself knowing that. I just couldn't. And me and her spoke about
Yeah.
it, and she sort of agreed with me, like, no, one day when that child wants to know their name and what their father looks like, I believe that
Yep.
they're entitled
Mhm.
to that. Like they're human.
Yep.
Like who doesn't want to know where they come from?
Mhm.
And so that is sort of on the sperm donor side. Yeah.
Perfect. Yes. Now you can continue on with your story. No, I'm so happy that I asked that question, because I don't know if people actually think about all those details when it comes to finding a donor, but I know how the scarcity of finding Black donors who meet all those requirements. So I'm happy that you
Yeah.
shared that.
Very scarce. All of our donors were of Black like lineage, but most of them had like they were Black Puerto Rican, Black this, Black that, because Black donors were so scarce. And if you found multiple Black donors, they were on sites that weren't, to me, felt
Little
well,
shaky.
yeah. And I was like,
Yeah.
no. And then
Yeah, we
our fertility clinic also was very particular on even banks that we could use.
Yeah.
Right. So and that was the other part too, I wanted to make sure that you talked about. So I'm happy you said that too, because fertility clinics are very specific about
Yeah.
where donor sperm's coming from. And then
Yeah.
even as you move to the IVF process, they're probably even more stricter too. So
They
you can
were.
talk
They
about your IVF process.
Yeah.
motility,
And
and then making sure that that donor was completely tested. Like
Mhm.
they were very clear on things that they just don't allow. I will say that, and this is kind of sad, but when we first started the IUI process, they were like, okay, you need this, you need that, and we were like, okay, like, okay, cool. And so we were spending a lot of money on like premium, like sperm. And then come to find out, they were like, oh, well, we
Yeah.
really only need this. And it's like,
Yeah.
so we 4 cycles in. We didn't spend
Yeah.
$3,000 per cycle based on when you talk about the medication, the actual IUI of $1,800 and the sperm. And y'all want to now tell us that, oh, we really only need a motility of like 5 million to 10 million for a successful pregnancy. Meanwhile, y'all got us out here buying 25 and 50 because that's what we thought we needed.
Yeah.
You know what I mean? Like, it's kind of like things like that, that like fertility, like they just got to do better at communicating with the patients and the process. Like those little pamphlets are cute. The little portals they send us to in the videos are cute. But there just has to be a more detailed nature of the process and what they're doing. And we go to a fairly big fertility clinic. I'm not going to mention their name. But it almost sometimes feels like a meal.
No, I was going to tell you though, because I kind of already know who you go to if you're in this
Feel like a
area.
meal.
I was like, we'll talk offline.
Yeah.
But I will say that yes, you are very much so a price ticket. They see you all as dollar signs as you're walking into the door.
Yep.
Especially since you have to do this in a non-traditional route. It's almost like, okay, check, we're gonna keep adding on as many procedures, as many protocols, as many medications as we can, because we know that this couple wants to have a child, right? And I think that that's the nuances. Obviously, being Black in America is one thing, right? But being Black and having a same-sex couple come into these clinics to try to go through this process, you already have that other discrimination against you. So I would love for you all to talk a little bit about that too, as you talk about your IVF journey.
Absolutely. Thank you. It has been very, very interesting. Very interesting. Go ahead, baby.
Good.
I will say that when we decided to journey it to the IVF side, the process became a lot more clear. And I'm assuming because there are these national protocols and all these very clear-cut guidelines. It's not like IUI where it's like, well, we might can and we may can. And this time it's like, no, we're getting your body to do this for this particular thing. And then the next step is this. And we got blessed, hugely blessed, because we got the letter and literally it said, okay, for the ages of 30 to 35, it was $19,700. And then at 36 to 40, it went to like 22,500. So we were like, okay, we're not gonna wait a year because I'm about to jump that other gap, and that's what's going to increase this about $3,000, almost $4,000. So we're going to go ahead and pay this $20,000. So at this point, Tori and I were like, okay, what are you going to take from your retirement? What you going to take from your retirement? How much we have in savings? This, that, and the third. So we're balancing our books. And then I'm a veteran. So I was talking to my doctor at the VA. Man, talk about the angels that God sent you. She's like, both of my children went through IVF. And Tori and I were like, really? And she was like, She said, do you know that there's a special program for veterans called the Bob Woodruff Foundation? And so we were like, no, we never heard of it. She said they sponsor veterans for IVF. And so we were like, they do? Never. Where is this nationally? Like, is it on a billboard? Is it, when I Google this, where is this? Like, so I had, and she's a Black doctor. So this is me and her vibing on this, but where is this information being put out to the world for the people? Because I've never heard of this. And I've been going through this process for 4 years at this point with all my IUIs. So I'm a little lost. I'm a little taken back. And I'm like, okay, so she gives me the online information. I go up there. I'm not kidding you, Erica. This is like a Monday. I fill out the form, send them all of my disability, VA, all the things that they're asking for, a letter from my fertility doctor. It was a bunch of checklist stuff, a bunch of stuff. But I was able to get it done in 24 hours. Got it done, submitted the packet. Tuesday. By 5 p.m., I was getting a call. We cutting you a check. I can't make that up. I can't make that up.
I'm so excited.
On a Monday, on a Tuesday, I got a call. And we're going to sponsor 2 of your cycles. So we're going to cut you a $5,000 check for the first one. And then if that one don't work, we'll cut you another $5,000 check for the second cycle. Right? So Tori and I were like, Okay, that's $10,000, but they don't give it together. What do we want to do? Do we want to just take the 5 and put it towards the 19.5? Because the 19.5 was for 6 rounds. That was for like a lifetime, what they call lifetime IVF. And then if you don't take a baby home, they refund you all of your money.
Yeah.
So we were like, well, you know what? Instead of doing $5,000 and doing one cycle, because I think one cycle at the clinic was like 18.7, and it didn't include any medication or anything like that. And so we were like, well, instead of doing that, and we would still have to come out of pocket the other 3,000, let's just come out the pocket the whole rest of the 13, do the 5, and then just, you know what I mean? Like, let's just call it what it is and have our 6 cycles. So that's what we decided to do. But that $5,000 came in so hard. Like, we were like, what a blessing. And how do people not know that this program even exists? And not only did she process my application with the blink of an eye, she still emails me now and says, hey, baby, checking in on you. Checking in on you. How's your process? Like, the beauty in that. Just talk about the love, all that love. And so we ended up saying, okay, I ended up convincing her anyway. Like, okay, let's do it in June around my birthday. And then by the time we walk down the aisle, I'll be 3 months, and then I'll announce it at the wedding, and I'll be like, and then she was like, okay, yeah, let's do it. So I was like, okay. So we ended up saying, okay, let's start IVF. So they wanted to put me on birth control, completely regulate my cycles. And then they were going to start the process for giving me all the medications to start to increase my follicles to grow so they could do the retrieval. And so I started on the birth control. Everything was perfect. I started to do I was on almost 4 injections a day. Just trying to get my eggs to grow. Everything's going well. Then finally one day I'm on the couch, and I'm not kidding. I'm on the couch and I'm so lethargic. I'm just like so tired. And Tori's like, well, it's all that could be all the meds. I was like, yeah, I'm gonna just sleep. I'm gonna just lay here. I literally slept on my couch and didn't get up. The next day I was still in the same position on the couch, and I was so tired. And Tori was like, no, something's wrong. And I was like, oh, you think so? She was like, And then I kept like pressing on my stomach, and I kept being like, I'm in a little pain too, but maybe it's because all these eggs is trying to grow. Like, I don't know what's happening. Then my back started hurting, and she was like, get up. We're going to the doctor. And I was like, I'm tired of hospitals. Like, I think I'm fine. And she was like, nope. You've been sitting on the couch for 2 days. You've been in the same spot. I've been watching you push on your stomach. Something's wrong, Ty. We're going to the hospital. And I was like, okay, that's fine. Let's just go. We go to the hospital. They're running all these tests. They come back. They're like, we think we see something, but we're not sure. What you mean you think? Well, we don't know. So we're going to keep you overnight for observation. And I said, okay, but you're keeping me overnight for observation, but you're not even sure what you're observing. What are you observing? They literally were like, we're not sure. And so I left the hospital on against medical advice, the AMA. And so I was like, I'm gonna go home. I'm gonna go to sleep. I was so tired because at this point we were in the hospital for almost a day. It's like 2:00 in the morning when I'm leaving out, and they're still like, they didn't know what was wrong. So we were like, we're just gonna go to a better hospital in the morning once I got some sleep. So I took an ibuprofen because I knew that this cycle I was gonna have to call the doctors and tell them no because I was in so much pain. So I took an ibuprofen, laid down, and then I woke up. I said, oh, so I'm feeling better. Maybe I was just like, in a little bit of pain. And then about 30 minutes later, pain came right back. I was like, okay, yeah, let's go to the hospital. So we go to the hospital. They look at my lab work because when I left the other hospital, I was like, give me everything you got. Give me everything you got. So I walked in the next hospital like, this is what they ran yesterday. This is what they said. And they were like, this other hospital was like, what? Like, what? Like, it's not even making sense. Like, how did they not find anything? But they wanted to keep you overnight. They were like, the doctor was like, I think I know what's wrong, but let me send you down for a ultrasound and then we'll talk about it. And I was like, okay. They sent me down to the ultrasound, and I already knew that ultrasound text found something because she kept going, ooh. And I was like, what is she looking at? Like, what is it?
Yeah.
They get me back down to the ER where Tori is waiting for me, and they're like, okay, Tori, she's being admitted. She's not going home anytime soon. And so we're like, okay, what is going on? And they're like, you have a massive blood clot in your spleen. I know, like your spleen. And they were like, literally, like, this is borderline like life and death at this point. Because if your spleen rupture, that's it. Like we can't save you. We got to get you in right now. And so we were in shock. We were like, what's happening? They admitted me. I ended up being in the hospital for almost 7 days. 7 days. I literally went into the hospital on like June 19th. My birthday is the 25th. They ended up releasing me on the 24th, the day before my birthday. And I think that was just in pure love of them saying, we don't want this baby to spend her birthday here. Because I wasn't necessarily a bad patient, but I definitely was emotionally just drained. Like I was just drained. And thank God they were so loving the tour, because they kept saying like visiting hours ends at 9 and baby was at 11 midnight. They were like, all right, we understand, like love on her some more, then get up out of here. But I was on heparin for 6 days. At that point, I knew the protocol was done and over with, because I began to bleed. And when my cycle came, I mean, I bled. It was all, I actually stood up and it was all over the floor. Like the nurses had to come in and like clean it up. And they had me on I couldn't get out of the bed because I was on heparin. So they had mats on the floor as a fall rest. So that was like, it was just a lot going on, and being in the hospital for 6 days and wondering and asking God, why? I thought this is what I needed, IVF. Now I'm trying to do this right. I'm following the protocol. I'm doing this, how, what, and then come to find out they were like the birth control mixed with all the medication. Sometimes women on birth control tend to get blood clots. And so now, oh, by the way, before we can start you anything with you, you have to now have a hematologist watching you. So now we have to find a hematologist. And so we do have an amazing hematologist that we love now. And so the hematologist got with us. He was like, okay, got this done. This is going to be your protocol. Loop me in with your provider. He literally got on with my IVF endocrinologist, and that's how bomb he is. He was like, everything she doing, I need to know. Everything I'm doing, she need to know. Like he was top notch. And a older white man. I'm talking about, he was on top of it. Boop, boop, check. Come here, boop, boop, everything. And so he said, okay, when you guys start back again, you need to see me first before you see them, because I need to make sure your blood levels, everything is right. Because if none of that's right, that your pregnancies aren't gonna be right. And he's the one who told us that possibly this issue is why none of those IUIs work, and possibly why the miscarriage happened with the healthy baby that they couldn't find any problems with. Because if you probably had a small blood clot that just began to just grow and grow and grow over time, and none of that blood isn't circulating right to the uterus and throughout your body, the baby can't oxygenate, can't grow, can't breathe. And he's like, that's probably what was happening this whole time. Your uterus, all that, there wasn't even no blood in there flowing properly. And so we were just like, get out of here. And he showed us like the picture of what the spleen was, and it kind of looked like a water hose. Like you take the water hose and then you clamp one end of the water hose. So this end was just like balling up like a bulge, and it could have ruptured at any point, but it just was like a bulge, like a huge, like a grapefruit, just like, and no wonder why my back and stuff was hurting so bad. And so they, so the whole idea of surprising at the wedding, that's off. That ain't happening. The blessing in this all is, one, I know that I think the first thing I said after that was, God spared my life. Okay. He spared my life because I could have died. That couldn't have happened. I could have went on with the retrieval. I could have went on with the transfer. I could have had a pregnancy, and there are women dying every day due to blood clots. Like, he spared me. And that is what I hold on to. I hold on to him sparing me. And each and every one of my actual, like even the ectopic and all of these, like he just sparing me. So I know that there's a story. I know that there is something here. I just hadn't tapped into what that looked like for me because I was too busy in the trauma to even focus on what he was trying to guide me to. And so 6 months, we got married. And we had a beautiful wedding. Oh, we had a beautiful wedding. I know everybody say that, but we had a beautiful wedding.
Well, if the folks who are watching, you can actually see the picture of y'all's wedding behind y'all. You got a picture on your leg. You can see a little sneak peek of their wedding.
Yes, we had a beautiful wedding. We were surrounded with love and family and friends. Again, I'm from Texas, so I had tons of family come here. We got married in Baltimore, Maryland, super Black, super Afrocentric, just a lovely place to be in. And it was just beautiful. And then we had a 38-person honeymoon.
Yes.
To Costa Rica. And it was beautiful. It was beautiful. Our travel agent is one of the best travel agents in the world. And so she did everything. Like, we didn't have to lift a finger. All we had to do was pack, get on our plane, and then pack and get back on the plane. Transportation, everything. She had all these excursions, dinners, wedding dinners planned for us on the resort already. Nothing that we planned. She did all of this. So she knew our story too. So she was just like, I just want y'all to just be enjoyed, be in love, and just enjoy this moment. And it was great. It was fantastic. Our friends who didn't know each other got along so well. I mean, we were just like, we got to like sneak off and like have fun, like private us time, and knew that our friends who didn't know each other were just loving all over each other. It was amazing. It was so amazing. Costa Rica was bomb. And then we came back and the doctors were like, okay, come back in. This is September of 2021. They're like, come back in so we can run your blood test and all of that. So they do it. They also do ultrasound to make sure the spleen is intact, make sure that it didn't leave any damage or anything. They were like, yep, good to go, everything. So the doctors, when we went to gear back up for our IVF cycle, which is September, so that was September, November-ish is when we were like, that was that 6 month mark where they were going to allow us to start the process for doing the retrieval. So November, we started the workup. And at that point, they wanted to look at my ovaries again. I did an HSG. I did a scratch. They tested everything. They were like, okay, because of everything that happened, we're just going to run back through everything. Look at your tubes, put some dye in you. We're going to do everything. And so the whole month of November was just spent on workups, testings, and things of that nature. They came back like, mommy, you're fine. December, we'll start the process for the retrieval. Like, okay. This process, though, they were like, no birth control. None. You can't do birth control. You shouldn't be on birth control. We believe that was one of the number one contributing factors to the blood clot. And so we're not going to do any birth control. And in fact, once you redo a retrieval, we're going to do something that's called a natural IVF cycle. And so me and Tori hadn't even heard of what that was. So we had a fairly good retrieval. We took out 13 eggs, 13, 9 were mature, 7 fertilized, and 7 made it to day 5. So fairly good. And then we didn't decide to do any testing because the doctors were like, you pretty much, when we did the biopsies of the 9-week-old baby boy and the 6-week-old baby girl, we found no genetic markers, no issues, no problems. So we don't really think we need to test your eggs. Like, let's go. So we did a fresh transfer right after the retrieval. But I had a little bit of what they call OSOH. So I had a little bit of ovarian
it's-
hyperstimulation
yeah,
going
that's-
on. So, and it wasn't severe at all, but it definitely was to the point where I couldn't sit up sometimes, and I couldn't even hold my own urine. I could not hold my own urine. And so that, I don't think the transfer, I think my body just wasn't in a healthy state to even, for that transfer to even happen. But we did it and it didn't work. And so we kind of were like, okay. So we knew the others would be frozen. So December, we did that. And then January, we did another, and it didn't work. No, January worked. January
Oh, it
worked.
did work. Yeah.
And so we were like,
Yeah.
and we were so excited. We were so excited. And then I could feel my body not being pregnant. It was like a weird sense. Like after being pregnant the 2 times before, I could feel when like my body was going through something. And then that one was, I just felt really different. I felt really, really different. And I was like, something isn't right. And her over here is like, stop it. There you go with that negative self-talk. You're fine, baby's fine. I'm like, no, you're not hearing me. I'm telling you, it's my body. Something's wrong. And so she was just like, nope, stay off Google. I don't want to hear it. You're fine. She was not trying to hear it. And I was like, okay, whatever. So we go to the doctor, and the doctor's like, you had what we call a chemical pregnancy. Like came and went. But mommy, that's okay, because that's your body doing what it's supposed to do. And so we were like, okay, sure. So we were like, we want to transfer 2 eggs. We're tired. Like we did 2, we had 9 IUIs. They were like, nope. And we were like, yep. They were like, no. We were like, yep. Like we literally had to advocate for ourselves. Like my body, my money, y'all have protocols. I get it. But at this point, we're beyond what, clearly I had an ectopic on my ovary that happens in 1% of pregnancies. I had a blood clot in my spleen that they say that they've really only seen those cases happen overseas and not even in the United States of America. So clearly I'm defying all these odds of what y'all talking about, that of protocols. So I don't want to hear about y'all protocols or y'all science or any of that. I want 2 eggs to be transferred. We want to do this. So finally they were like, okay, we're going to do 2. And so we went in to do 2. One of the embryos didn't thaw well. And so we ended up using the last 2 eggs. And so they were like, okay, no problem. We're going to transfer the 2. They transferred the 2. They were beautiful. And so and then here's the kick. This is now February. So her birthday's in February. And so I kept looking at the calendar, and I was like, we're going to make this baby on your birthday. And she was like, girl, I was like, we're going to make this baby on your birthday. She was like, okay, whatever. The 19th they call. Trigger tonight. Come in on the 22nd for your transfer. I said, baby, on your birthday. And legit, Erica, it was 2/22 of 2022. We were transferring 2 embryos on the 2nd floor in room 2. I can't make that up. I can't make it up. So literally when we walked in the building, we were like, we pregnant. We pregnant. We was walking around telling people, excuse us, we pregnant. We hadn't even had the transfer yet. We was like, excuse us, we pregnant. Excuse us, pregnant lady from the crib. Like we were just enjoying. We were just like all loving that, all of that. And the doctors, the nurses, like when they were looking at the paperwork, they were like, 2/22, it's your birthday. They was like, y'all pregnant. We was like, yep, we pregnant. Like everybody, and it's not something we said to them. That was our energy, but that energy must have sparked a flow because everybody was like, yep, yep. And sure enough, we got pregnant. And I was like, I told you. And we went to the doctor, and they were like, okay, mommy, we know the last time we brought you in here at 6 weeks, it wasn't, but this right now, we're not looking for a heartbeat. We just want to make sure the babies are in the right spot. We don't want you to think about nothing else. We're going to bring you back in 2 weeks at 8 weeks for the actual heartbeat. We just want you to focus in on the baby being in the right spot. So we were like, okay, no problem. But when they did that ultrasound, they was like, do y'all think y'all got two babies in there or one? I said, I think it's one. So it was like, you think it's one? I said, I think it's one. So they started doing the ultrasound, and sure enough, one baby. And the doctor was like, "Oh, and the heart is beating already." And that little heart was beating, and we were like in love already. We was like, oh, look at Gabby there. Gabby there. And we were just in love. And the excited thing, our doctor, you could see the stress on her face and in her body. You could physically see the tension in our room. And when she saw that heartbeat, she literally said, like, you could see like she was like, oh my God, this has been my patients for 5 years now. Like, they like, what is, like, she was just like, and so we were like, oh, and then she was like, okay, come back in 8 weeks. So we was like, okay, 8 weeks, baby thriving. Come back in 10 weeks, baby thriving. They like, okay, mommy, do y'all want to come back for one more before y'all graduate? We were like, yup, we want to come back for one more. But meantime, I'm already looking for OBs. I'm already doing everything. And so they brought us back in for one more. Baby was fine. Went to the OB appointment, was fine. They did the testing. The results came back, was fine. At that point, our friends looked at the results because we didn't want to know the sex of the baby. So they were like, baby healthy, gender reveal on deck, done. We like, got it, all right. So at this point, it's March going into April. My birthday's in June. So I'm like, dinner party for my birthday for my gender reveal. And then I'll have a September baby shower. And so they were like, perfect, got it, say less, sis, we got you. So chugging along, healthy baby, and everything's coming out pristine. They're like, okay, mommy, based off your age though, and because it's the IVF baby, we need to get you in to see an MFM ASAP. So we were like, okay, no problem. At this point, I'm 14, almost 15 weeks. And so I call the MFM to schedule an appointment. Nobody's answering the phone. I called for 2 weeks straight. Nobody answered the phone. It wasn't until I went back to my doctor's office and was like, okay, the number y'all gave me, nobody's answering. And they were like, what? So they called, nobody answered. They called right in front of me. They're like, okay, wait a minute. So, then next thing you know, they're like, oh, really? Okay, thanks for telling us. They're like, oh, mommy, we're sorry. That office is closed because that tech had a family emergency or something. And so they moved all their patients to somewhere else. And we were like, what? Okay, just give us a number, let us call. So now at this point, I am like 17 weeks. So, and they were like, and you're fine. You can do this until you're 20, 21 weeks. So you're right. You're right in protocol. So we were like, okay, no problem. So we called them on the phone. They were like, well, we can see you on June
Like 19th.
the 19th. And we were like, oh, that's perfect. That's like a week before the gender reveal, just to make sure everything is good. We were like, okay, that's cool, because we about to go fly to Texas so my mommy can see my bump and see my goddaughter was graduating from high school. So we were like, okay, this is perfect. Fly to Texas, everything's fine. I see my family, I see my friends, love on everybody. Fly home from Texas on the 17th. And I'm telling you, like, babe, make sure that your job know that even though we back, that we still have an appointment on the 19th to see the MFM. That night, I'm like, my stomach was hard as a rock. Like you could like, I feel so bad that we running late.
No, it's not you. It's all my interviews today. It's been good though. It's fine. Continue on.
My stomach was so hard, like a rock. And I was like, something ain't right. So I told babe, I was like, babe, my stomach really hard. And she was like, really? But I said, but it's like softening up now. So I was like, no. And I said, I think I felt a contraction too. And she was like, what? I was like, yeah, but I Googled it and they said that could just happen. And I was like, here go me. I don't want to say I'm always negative, but I can be pessimistic in nature because of all the things that have happened. So here go me now, trying to be connected to my wife and be optimistic. So I'm like, no, I ain't Googling. No, I'm not finna, if I Googled and it said it's gonna be cool, I ain't Googling nothing else. I ain't doing it. I'm fine. The next morning, I woke up, I was fine, went to the bathroom fine. I was teleworking, got up to get me some lunch, went to the bathroom, and I had blood. And I freaked out. I called her. I was like, babe, I gotta get to the hospital now. I'm bleeding. So she's panicking. What? Come on, let's go. So we driving, and I'm like, I literally grabbed her hand, and I'm like, I need you to slow down. I need you to focus, and I need you to know that me and this baby are okay, but we just got to go get checked. But we got to get to the hospital first. So I need you to slow down. We're gonna be all right. So we get to the hospital, and I'm literally in tears because I'm like, I'm contracting. I don't know what to do. And they're like, you contracting? I'm like, yeah, how far along are you? I'm 19. I was 19.2 at the time. They're like, okay. So they rushed me to the L&D of the emergency room. So they get me in there. I kid you not, I cannot make this up, Erica. Those folks, I was there for 2 hours sitting up, like just sitting up in the bed. Somebody came to do a cervical check. She walked out. When she came back, she was like, so what y'all want to do? We were like, what do you mean? She was like, well, so you dilated 2 centimeters. So what do y'all want to do? We were like, medically save the, we were taken aback. And it breaks my heart, right? Because one, I was teleworking, and so I was looking a hot, raggedy mess. And when I was at the hospital, I definitely was looking rough. And at that moment, I began to think, is my locks, is my color of my skin, is how I dress an interpretation of, I'm sorry, the care that I'm about to receive. My heart broke. Because is that the standard question? What do we want to do? We want to do everything to save our child. And so at that point, she said, okay, no problem. She walked out the room. A nurse then came in the room and said, Mommy, you have to lay back. But I've been sitting in this hospital for 2 hours, sitting up. If I needed to lay back, that should have been something that I should have done the moment that I stepped in here. So finally they laid me back and almost had me upside down at this point. Then they say, we need to get you to the MFM. They get me out of bed. I walk to the MFM. She is so rough on my stomach. I'm talking about physically punching my stomach with the ultrasound machine. Like, ooh. And then she say, what you having? At that point, we really didn't know. So I had called my best friend and I was like, tell me what I'm having. And she was like, nope. I said, tell me what I'm having. She was like, nope, you're gonna be fine. You and that baby coming home. I said, her name's Erica too. I said, Erica, I'm in fear and I need to know what my child is. And she said, ugh, it's a boy. And I was like, so I completely lost track of, I'm in the hospital. This could be a dangerous situation. Or I don't know what's happening. I wasn't like, oh my God, it's a boy. It's a boy. And so now she's like, what are you having? And I was like, well, my friend just said it's a boy. Like, I think it's a boy. And she said, you think or you know? And then we were like, well, we did a blood test and she has a result. So we're pretty sure it's a boy. Like, I don't know if she was trying to be passive aggressive or just rude or what, but I think my energy wasn't willing to give her the same energy back. I was just trying to like, what's going on with my child? So she was like, oh, he's a stubborn little boy, whatever. And then we started laughing because I was like, I'm not surprised. I am his mother. Like, I am not surprised. Like, he literally looked back at he was like on his side and he like looked back at the ultrasound machine. And he was like, girl, like, you keep punching on me. I'm not turning over. Like chill, I'm asleep. And like, he like rolled back over, like, what? So finally she had me like shake my belly a little bit and then he flipped. And then she was like, yep, it's a boy. Then at that point, they put me in a wheelchair to roll me back to the room. So at that point, me and Tori were like, something else is going on. They let me walk here. And now they put me in a wheelchair to go back. Okay. So then at that point, surgeon comes into the room, maybe about 30 minutes later. He's like, hi, Ty and Tori. I'm Dr. Such and such. This is gonna happen. Your bag is bulging. Your bag is hanging out of your dilated cervix. So on Sunday, this is a Friday, we're gonna have emergency surgery. We're gonna turn you upside down. We're gonna give you these medications. We're gonna use a special machine. It's gonna push the bag back inside of you, and then we're gonna sew you up. And I said, okay, well, what about the contractions? The man said, she's having contraction? Y'all haven't stopped the contraction? And we were like, I mean, telling this right now, I mean, it's so hurtful. It's so hurtful, like that's how we were treated. And that I'm not saying that this hospital could have saved my son, but could they have? Could they have? And so immediately they were like, oh, we're gonna give her the med. So at this point, Tori is going from like calm to anger. So she's like, no, you're gonna give her the meds now. Give it to her now. So like every time a nurse would walk by, she would be like, she still ain't got her meds. She still ain't have the meds. She's still contracting. And like I was contracting to the point like I was squeezing Tori's hand, like, ooh, here come another one. Like, and then they got me upstairs. They were like, okay, they gave me 2 medications. I took the meds. And immediately they were like, Tori was like, well, you haven't eaten all day. You were getting lunch before you went to the bathroom, so you haven't eaten. So I'm gonna go get you some food while they stopping the contractions. She go get food, she come back, and she's like, you hungry? I'm like, no. She's like, baby, please take a little bite, just like a tiny bite, just like a nibble. I was like, okay. So I took a bite of the sandwich and I like was chewing it and I laid back and I was like, nurse, I was like, I'm nauseous. Can I get something to stop the nausea? She's like, well, that first med I gave you, that is an anti-nausea. And I was like, well, I'm very nauseous, so something isn't right. And then next thing you know, I started, projectile vomit. And when I went to, and it came out so forcefully, my water bag just said, and it ruptured and it just went everywhere. And I'm talking about like on the movie scenes where it just goes everywhere. And at that point, I'm physically screaming probably to the top of my lungs because I knew what the doctor had already told me, that if this water bag breaks, that's it. That's it. There's nothing we could do. And his whole goal was to get the contractions to stop, to get me into emergency surgery on Sunday. And I knew. And so they went to scrambling, running, blood is everywhere. They all in between my legs. And then she said, I don't see any scretum or some word that she's looking for in the fluid. She's like, I don't see it. So I don't know if this baby's coming. And so we were like, what? And then they were like, do you feel contractions anymore? And I was like, no, I don't feel anything. There's nothing. And they were like, all of that pressure was from the water bag. The baby probably had pushed back up and that was just the water bag. And so I was crying and the doctors came in. They was like, it is not your fault. You threw up because of all of that pressure coming down. You didn't do anything wrong. You couldn't control throwing up. You threw up because of all that pressure. It's nothing you did, mommy. But I was hollering, like I was screaming to the top of my lungs at that point. And I was like, don't touch me. And I'm soaking wet because water is everywhere. Then they finally come in and they're like, please let us clean you up. Please let us clean you up. And so at this point, Tori's mom and stepdad are at the hospital. And I'm a ball of tears because I keep apologizing to them. Like, this is your grandchild. And I'm sorry that I'm incapable of carrying him. And I just felt so guilty, so guilty. And the doctors came in and said, but we're going to try to do everything to get that water bag back full. So we went on IV fluids. And then I was drinking like 2 gallons of water, like every few hours, like 2 gallons. And then they moved me down after I went through day 1 without Gabriel coming, because we named him Gabriel. After I went through day 1 without Gabriel coming, they moved me down to like a special mommy ward for high-risk moms. And then they had this big old thing on the board, like 9 + 3 with a big old heart. And then every day they would wipe it off, 9 + 4, 9 + 5. When we got to 9 + 5, I was like, something is not right. And I kept telling Tori, I was like, oh, I'm hot. And so, and then we ate, and I was like, and I don't feel good. And I was like, oh, them wings. I was like, I don't want no more of that. I was like, I don't feel good. So that night, I called the nurses in, and I was like, I think I'm having more contractions. And so they hooked me up to this machine, and they were like, you ain't having contractions. We don't see no contractions. And so at that point, I was like, okay. And I called them back in again. I was like, I think I'm having contractions. They came, they hooked me back up. They was like, we don't see anything on this monitor, mama. You're not contracting. How are your bowel movements? And so I was like, well, da, da, da. So they was like, okay, let's up the dosage of the Colace and see if that'll help. And sure enough, I had a really good bowel movement, and then I didn't feel any more pain. So I was like, oh, well, maybe I did. I was just constipated, whatever. Tori says she could see Gabriel, like I was knocked out, pushing on my stomach or whatever. So she said he was really active, like kicking and doing stuff. And at that point, I hadn't felt him kick before. And so that night when I rubbed my stomach, I was like, oh my God, I can feel him kicking. I was like, oh my gosh, he's kicking. I mean, he was just kicking. And then next thing you know, I was like, ooh, I'm having a contraction. And she broke down. She was like, and I say, hey, you know what I need? I need you to pray. I need you to pray. That's what I need. I need you to pray. I need you to pray that they stop. I need you to pray that he's healthy. That's what I need. I need you to, I don't want you to cry. I need you to pray. And she was like, okay. So we started praying. The doctor came in, and then she was like, let's hook her back up. Let's see. And they still were like, we don't see no contractions. And so we were like, at that point, I now have convinced myself that I ain't contracting. I'm like, okay, y'all go ahead. Maybe it's me, maybe it's anxiety. I'm fine. So at this point, it's midnight. And I'm like, Tori, and I don't want to be too provocative on the podcast, but she's physically holding my left cheek up because I think that I have to go to the bathroom, but I can't. They have me in trundle. So I'm like upside down the entire time, those last 4 days. The only time I sat up was to eat, and then they laid me right back down, upside down. So, and I couldn't get out of bed to go to the bathroom. Either way, they had me in a bedpan on using a bedpan at all times. Mm-hmm. So, I'm on my side because I'm in so much pain. And so I'm like, oh, this is the worst poop cramp I have ever had. And we did that for 2 hours. I'm not lying. 2 hours. It was 2 o'clock in the morning. 2 in the morning. When I realized that, like, oh wow, like I am like this might be real. This might be real. At this point, I'm gripping the sides of the bed when a contraction is coming, and I'm like, oh, like, and then finally I said, nope, I can't take it. I'm getting up and I'm going on the toilet. If this is boo-boo, we gotta come out. I'm going on the toilet. She was like, no, don't get up. You're not supposed to get up. I said, I'm going on the toilet. So I went on the toilet, and at this point I am sweating, Erica, like I'm profusely sweating. So I was so afraid for her to leave my eyesight though. She was like, well, let me get something to fan you. I was like, well, I don't know what you're gonna use. So she had a paper towel, and she was just like,
she put me to work. I just wanted a piece of paper.
She wanted something thicker than how to press, but I was like, don't move. I need you. We locked in. We locked in. Don't you move. And so she like patted me. She got another one on my forehead. She got another wet one on my neck. And I'm like, oh, this feels so good. This feels so good. Oh my gosh. And sure enough, I go to the bathroom, but I'm not pushing. It just flows out. So I'm like, oh, that feels so good. Yes. So she's wiping me. And when she's wiping me, Gabriel literally goes, bloop, like from sitting up in my stomach, he drops into my canal. Like I could feel him in my vagina. Like I could feel him in my vagina. And I was like, Gabriel is coming. He's coming. So she runs out of the room. She goes get the nurses. She's like, she's in labor. And they come flying in there. I'm talking about, I feel like it was like 30 people in that room.
Yeah.
And at this point, I'm butt naked. I'm in the bed. I am screaming at this point because I'm like, now that my brain has processed labor
pains.
Gabriel has dropped into my canal. All the pains that I had been dealing with all night all of a sudden they became the most
Intense.
intense thing I have
Yeah.
ever experienced in my life. And I am just like, give me medicine now. And the doctor came in, an amazing, dope doctor, beautiful doctor. She was like, mommy, you labored by yourself. You were 10 centimeters. There's nothing else to give you. We're gonna rush you down to L&D and get you started. And I said, somebody will give me some medicine right now. I don't kind of hear know what you're talking about. You gonna give me some medicine. So the nurse was looking scared. She was like, this lady, like, doctor, what we doing?
Do I give her meds?
Yeah.
She was confused.
Yeah. Like, if I listen to the doctor or the patient, because this lady here is giving me the business. And the doctor finally was like, yeah, go grab this, go grab that. And they shot me in my IV. And every time I wasn't having a contraction, I was a zombie. Like, when the contraction stopped, I was just like,
Yeah, you shut down for sure.
and then when the contractions came back, I was like, oh, so bad. Like, the medicine did nothing to touch those contractions. Like, them things was banging. Like, oh my gosh. But they rushed me down to L&D, got me set up. Gabriel came within about 30 more minutes. I pushed 3 times and he slid right on out. The placenta was harder than him.
Yeah.
He was so beautiful. He was born alive. He lived for 2 hours, struggling to breathe.
Yeah.
We got to love on him and kiss on him. And initially I didn't want to hold him. When he came out, I didn't want to hold him. I was so in fear of hurting him. And he was actually a big baby. When they came out, they were like, this is a 19.5. Who's his donor? Like, what size donor did you get? He was the size of a 21-week-old baby at 19.5. And so they were like, mommy, be prepared that he's only going to be with you for a few minutes. And when that few minutes turned into an hour, mommy gear kicked in. I was like, call Cleveland Clinic, call Shriners, call whomever you need to call. Me and my son are getting on a plane, a helicopter right now. Like, I literally was pushing, and the doctor was like, mommy, like, he is too small. And I was like, I don't care. We have defied odds this entire time. What are you about to do for my child? He's struggling to breathe. His poor chest, he was just, I was like, I can't. And when I wouldn't hold him, well, we like to call her our angel nurse, and I am going to say her name because she has a last name. So her name was Davita. We call her our angel nurse. She whispered in my ear, don't wake up with regrets. She could have let me not hold my son. She could have been like, well, she don't want to. She in shock. But she told me that. And at that point, I was like, yeah, give me my baby. Give me my baby. And the first thing I thought about was not his death. I thought about how big his forehead was. I was like, dang, why is your forehead so big?
She did.
And so was like, have you seen your forehead? Like, he was mama child, remember? And I was like, yeah, I did say that, right? He was so adorable. He looked just like me. He was sleeping just like me. He literally was like this. Like, and I was like, Tori was like, that's how you sleep. And it was just a beautiful experience. They did, after I pushed for like an hour, they were like, okay, we're going to get the team down and evaluate him. They came and they were like, mommy, when we start to do all those tubes and everything, it's going to tear his insides to shreds. And they were just like, he's going to, and if he does make it, he's going to be so severely disabled, he won't have any quality of life. And so love him now. This is what we want you to do. Love him now. And so at that point, after I processed that, which took about 10 or so minutes, I just went into just like, he had the darkest like hairline, like he was going to have so much hair. Like, and we just like looking at his little nose and checking I'll make sure he had all his fingers and his toes and just kissing on him and loving on him. And he was kind of heavy too. Like I said, he was the size of a 21-week-old. And so just loving on him. And he passed. And then at that point, they were like, but right at his final moments, and I guess they could tell due to his umbilical cord. So they kept coming over, testing his umbilical cord, and I could see that it was slowing down. And at that point, I couldn't hold him anymore. I didn't want him to die in my arms. I couldn't process that. And so his mommy held him until he passed. And she loved every minute of it. Every minute of it. In fact, every time I had him, she was like, "You gonna get my baby?" I was like, "Well, dang, can I hold him? I mean, I'm the one who just had the labor. Like, can I hold him?" And so it was, and those are the moments that we hold on to. The worst part about that whole story is just that he didn't come home.
Yeah.
Everything else, the labor, her holding my butt, the bathroom story, none of that's trauma. That's the beauty of my son coming into this world. And that's what we hold on to. That's what we hold on to. And that led me to finding you, which led me to saying, I will no longer sit in fear because I'm scared of not feeling like a woman or like a person. I need everybody to hear this story and know that, you're not alone. It's not just you. And especially for us same-sex couples, when this happened to us, there were no resources, nothing at all exists for us. And that's scary and it's sad because we cannot be the only same-sex couple out here with these traumatic events and stories happening, yet there's no platform for us. There's no love for us to go. And even if there's a place for me to turn as the mommy who delivered, what about my wife? Tori. And so that your podcast, and I'm not sizing it at all. I'm not, and because I know you hear this a lot, and people use words just as words, as fillers. But I use words as a part of my passion. I'm a good public speaker. And Tori, you saved my life, our marriage, and invigorated the thought that we're not alone in this story. Like it's gonna, like these things exist. They didn't just happen to you because you're a bad person or God is punishing you or any of those things, because the moments after I lost him, suicide was impending. It was around the corner. Like I had told myself, I'm done. My wife is young. She's going to be able to find her somebody else, but I cannot do this. And I had convinced myself that my son was born on the 20th and my birthday was the 25th. And I had told myself, well, none of your children live to see their birthdays. So maybe it's not meant for you to live to see your birthday. Like I had rationalized these negative and terrible thoughts to the point where I understood how we could be like, I don't understand how somebody could hurt themselves. At that moment, I understood it. Like, this is why they don't just do it. They have completely rationalized these things. Like they have thought through this strategically. And this is the decision. I've made it. I'm good. You guys aren't going to be good with it, but I'm good with it. And that's where I was. And then one day Tori said, let's go for a walk. And I was like, no, I don't do nothing. I don't see nobody. She said, okay, let's go to a trail that we've never been to before, where we're not going to see people that we know in the woods somewhere. And that's what she drove me to. And at that point, we were searching for things and we found this podcast and we cut it on. And the crazy thing is we didn't even listen together. We walked in silence with our headphones on, holding hands, listening to you. And then when we got back to the car, we just broke down like, I think she gonna save our life. So that is what led us to you.
Obviously, y'all got me in tears.
Oh man, I promised myself I wouldn't cry today.
I know, me too, and I normally hope contain myself. I think obviously your love story is so beautiful, and I'm deeply honored and grateful to do this work. I really am. But what I have gained in just your journey is just the faith that you both have, not only in each other, the friendship, but just in yourself. For you to trust your body this whole time, Ty, as you were navigating through this journey, and for you, Tori, to listen to her and say, no, we're going to go react, and how you all balance each other out. This is what partnership is, right? This is what you want in a loving partner. This is what you want as you navigate through marriage and through parenthood. And the beauty of how Gabriel was born, obviously there's a bunch of trauma in there, because they could have done a lot more things to help save Gabriel and not tell you to wait till Sunday to get emergency surgery when they could have did it on Friday, right? They could have did it that same day. And they could have told you more about what was happening to your body. You were sent angels. What was the Davita?
Yeah.
Because I got that same angel too. I don't remember my nurse's name, but she said the same thing to me when my son passed away. You don't want to regret not holding this son, your baby. Like, you need to hold him. It's the only time you're going to have to spend with him. So thank God for those angels that come out and really encourage us in those times that we just have no idea what to do. We're just at that point in out-of-body experiences, just like, what is going on with us? But I take that just with so much sincerity and honor, and I'm grateful for you all for finding the podcast and wanting to share your story. What I want you all to leave some encouraging words to same-sex couples out there. You kind of started it, but I really want you to really talk to them who listen to this podcast, because I want people to know that they still have the journey of becoming mothers and becoming parents. So what encouraging words can you leave with those couples who are going through fertility challenges?
Yeah, you want me to go first? Or
You
want to
go
go
first. Yes, of course.
I would say that no matter if you're journeying alone, because you can be a same-sex person and single doing this, or if you are in a committed relationship, a marriage, whatever the circumstances is, trust you above all. Doctors, nurses, all of that science stuff is cute, but trust your body, trust your mind, trust your heart. If your heart is telling you to do it, do it. If you got questions, question it. If you have feelings, go forth and address your feelings. You have complete autonomy over your body. And I think that's one thing that we didn't recognize in the moment. I think we had some white coat syndrome happening to us in that hospital. I think we got debilitated by fear. And I just want them to know that it's your body, it's your mind, trust it. And also in moving forward is your choice. It is your choice. I don't care how many losses you've had. If it's in your heart that you're going to be a mom and you're going to be a parent, you're going to be a mom and you're going to be a parent. I don't know how or when or what way God is going to store that in your life, but that don't mean it's not coming. That doesn't mean it's not coming. And that's what we live with. This feeling that we have, it ain't ours. We don't create our desires. We're just the working, the bodies to fulfill it. But those feelings of like, I want to start a podcast. God put those things in your life, Erica, for you to want to do this. You didn't just wake up and be like, you know what? Podcast. Like that's prayer. That's somebody pushing this. That whether it's a friendship coming in and God saying, I put that person in your life to tell you to do that. Trust in that. If it's in your heart, if it's in your mind, it's in your body, do it. If you want to try again, do it. If you don't want to tell people, don't tell them. If you want to shout it out to the world, shout it out to the world. You do whatever you need to do for you to heal and continue to go forth. And the last thing I'll say to every same-sex couple out there is that you are not alone. It is not heterosexual couples that are just going through this. It is couples of all different dynamics, colors, shapes, sizes, all across this world. So get out there and start to, we talk about it, becoming the platform for the next couple. So if you guys are thinking about it, start it, do it. Be the platform that you want for the world is what I would say for every same-sex couple out there.
You said everything. Jesus.
Gosh.
She just, oh my God. Okay, you really did.
Girl, you're a mess.
You did, but it's fine. I would say just, be strong, and hold on to your faith and be able to communicate and of course advocate for yourself.
Mhm.
And that's about it, really.
I'll drop one more gem if you don't mind, babe.
Okay, go ahead.
Find stability
Oh,
in
yes.
your village,
Mhm.
right? Everybody don't need everything. Everybody don't need everything, right? Everybody don't need everything. Find stability in your village. If your village becomes your counselor, that's cool. If your village becomes your church, even better. If your village is just you and God, great. Find it though, and plant that seed in that and water it and watch it grow. That's what, yeah.
This has filled me, y'all. Filled me up. I would love for you all to drop your social media handles so people can connect with you after this, because we want to see this. I want to see this journey play out for you all. I already know what is in store. We didn't talk about next steps, but we already counted on joy because I already know it's going to happen.
Right.
All right. We already know it's going to happen because you already made it this far.
Yeah. Ain't no
So
turning
where
back
can we
now.
follow your journey? Yes.
Yeah. So myself, I can be reached at Mac, that's MAK_kisses and on Instagram.
My Instagram is _Tori, TORI_22. So
Perfect. So we're going to follow them in their journey, you all. They continue on this journey to become parents because they're already mothers. I mean, they already birthed babies. They are going to become parents once this baby comes earthside to us. So I'm thank you all both for sharing your story on the podcast and bearing with me on time because we've been going over all day. It's been a dynamic interviews all day. So thank you all again.
We appreciate you having us, Erica. Thank you.
All right, guys, I got y'all recorded.